Good afternoon, colleagues. Nice to have you back for the Tuesday edition of the local COVID situation report. My name is Brittany Cadence. I'm the Communications Manager at Peterborough Public Health, and today we will provide the latest information and a few remarks from Dr. Salvatierra about how COVID is playing out in our community. Grateful to have you here with us today. And let's take a moment to reflect on this beautiful land that we call home. I'll start us off with a quick land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, it now gives me great pleasure to invite our Board of Health Chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Mayor Mitchell.
Thanks, Brittany. Ontario and Peterborough continue to see a slow decline in the number of newly reported cases. Although good news, it is important to remember that our rate per 100,000 continues to remain high, and that both hospitalizations and ICU occupancy are straining the healthcare system. The path forward needs to continue to be a dual strategy of aggressive vaccine rollout and a continued adherence to public health measures. At the same time, it is important to recognize that the community is exhausted and needs to understand the path back to normalcy. The development of evidence-based metrics and goals needed to be met in order to modify the current set of restrictions would be helpful. There are a number of things the government and healthcare professionals may want to consider. Lifting or maintaining restrictions based on the risk of a specific activity, and not simply on geography. Defining what constitutes herd immunity and how that would impact the types of behaviors permitted. Enunciating the type of activities and with what restrictions an individual would be allowed to undertake once they are fully vaccinated. Deciding if our goal is to reduce numbers to a level that the healthcare system can manage, or whether our goal is to substantially eliminate COVID-19. Providing regular updates to Ontarians on our progress and advance notice of when we could expect changes to the regulations. The vast majority of residents in our community have been diligent in following public health guidelines and stepping up when it has been their turn to be vaccinated. They are prepared to continue to take the actions necessary to keep us safe. Providing a framework of where we go from here would be most welcome. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell, for starting us off. So let's now, I'll invite our Medical Officer of Health, Dr. Salvatierra, to walk us through these next few slides. Please go ahead, Dr. Salvatierra.
Thank you, Brittany. Hello, everyone. So we'll begin with our current case count, and you can see that as of 4:30 p.m. yesterday, there were 65 active cases, just a few less than Friday after a very busy weekend where we saw 15 new cases reported. We continue to see the variants of concern as the dominant strain in circulation here in Peterborough. The ratio of high-risk contacts to cases continues to be higher in our region than in many other public health units. Currently, we are following 227 close contacts. This number has increased again by 11 individuals from last Friday's report. I think some of this reflects that there is still socializing with others going on. And I do hope that having one dose of the vaccine is not giving people a false sense of security so that they are letting their guard down too soon. We need to really stick with household members, especially when we are indoors. I think also the high numbers reflect the fact that we've had some very large households impacted. Some of these are families, but others are people living together. And we certainly have seen how quickly COVID can spread in these settings. So I will come back and touch on how we need to bring this third wave under control later in my remarks. Sadly, you can see here that we are reporting 2 more deaths of Peterborough area residents. So our number has risen to 17 since the pandemic began. Next slide, please. We can see here our weekly bar graph showing that we had 56 cases last week, the week of May 3rd, and that was down slightly from the 2 previous weeks, so that is good. Next slide, please. And here you can see we're beginning to tally our cases for May. And so for the first third of the month, we are at 71 cases so far. Next slide. We are showing a few more men than women in our cumulative case count. And as again, you can see that over half of our cases are under the age of 29. Last week's 56 new cases, 22 fell in this age group. Next slide, please. The percentage of community spread continues to creep up. That's the deep yellow bar there. We are now reporting 19% of our local cases in the last 4 weeks are due to community spread, where we have not been able to find an epidemiological link. We're also showing that the rate of cases that are from close contacts is also increasing. You'll see that we are now up to over 70, well, almost 77, I'd say. 77% of our cases are from close contact. And this, I think, reflects the amazing efforts of the case management and contact tracing teams who continue to work 7 days a week to reach everyone who may have been exposed. Our next slide is on testing, and here we show that another 700 people were tested for the first time last week in Peterborough. We're continuing to see high testing rates, which is great. I want to thank my colleagues at the North Crest Arena and at PRHC Assessment Center, as well as the pharmacies who are offering this important service to ensure that testing is as accessible as possible. The next slide has some good news. The number of active outbreaks, it has declined. We're now down to 4 outbreaks, 1 less than last Friday, thanks to the one of the workplace outbreaks having resolved. So I expect that the question that's top of mind for everyone is, when will we bring this third wave under control? Well, I certainly don't have a crystal ball, but I thought I would share a few observations. At the provincial level, daily case counts are still high. While our local number of cases have declined, they are falling very slowly, and we still see daily fluctuations. Some of the important indicators that we will also need to watch are those such as the percent of people who are being tested who are positive, which we call the percent positivity rate, and also the reproductive number, or the number of secondary cases each new case produces. They all need to come down. They are coming down here in Peterborough, but we have a ways to go before the stay-at-home order can be lifted. We're also learning that in this third wave, one dose of vaccine is not enough to allow us to loosen up with our public health measures. This is sadly reinforced in some of our recent local deaths, where individuals had received their first vaccination, but still contracted COVID before their immune systems had had the chance to mount a strong enough response. It is critical that we do not plan to reduce our public health measures until enough of us have received that second dose and are fully vaccinated. On the positive front, in long-term care homes and retirement residences with high levels of full immunization among both residents and staff, they are starting to resume some of their congregate activities for the first time in a year. This is the beginning of reopening, and it must be measured and fueled by timely and accurate data in order to do it right. The reopening of schools is still under active discussion at the provincial level. Medical officers of health and our provincial colleagues have been meeting regularly to discuss this. Above all, we need to make sure that whenever we can leave our homes to restart new activities, be they work or be they school, we can't risk the beginning of a fourth wave. Please continue to follow the public health measures until we have higher rates of vaccination in our total population. With regard to the vaccine rollout today, the province extended eligibility to people with at-risk health conditions and to the second group of those workers who can't work from home. This coming Thursday, in 2 days, we expect that eligibility will again open up to people who are 40 years of age and over. As of this morning, we had 2,000 open appointments available, and I'm expecting that they will likely book up very quickly as these new groups become eligible. Locally, we will open up more appointments in the coming days and weeks for dates in June as we confirm our vaccine supply. I also would like to clarify the recent news about groups that have become eligible for a shortened interval between doses. The province announced yesterday that the highest risk healthcare workers will become eligible to book their second doses at some time before the end of this week. This is a few weeks earlier than the 16-week interval, and it will be a welcomed development, I know, for those frontline workers, especially those ones caring for patients with COVID-19. The other group that can go ahead and book their second dose ahead of schedule are the urban Indigenous families, and we are working with our local groups to organize those second dose clinics with them and for them. To wrap up, I would like to thank all of the residents who have kindly sent my team encouraging messages through social media posts, letters to the editor, and through the mail. I make sure to share these during our weekly all-staff meetings, and they are a true source of inspiration as we all put our shoulder to the grindstone to push through this third wave. Thank you.
Thank you very much, Dr. Salvatierra. Great. Okay, so today we do have some of our elected officials with us today. I see MP Miriam Monsef and our municipal representatives, Mayor Therrien and Warden Jones. So why don't we start with MP Monsef? If you've got an update to share, please go ahead, Miriam.
Thank you so much, Brittany. Hello, colleagues. Bonjour, Anin, salam alaikum. I join you from my home in Peterborough, Kawartha, and Mississauga, and Anishinaabe territory. Dr. Salvatierra, Chair Mitchell, thank you so much for your leadership in these difficult times. And like you, I'd like to salute the nurses in our community and indeed across the country who are stepping up and have stepped up for more than a year. We appreciate you. We particularly acknowledge how difficult it's been for moms who are nurses as well as those who have caregiving responsibilities at home with their loved ones. We know that the best way to thank you is to limit the spread of the virus, to roll up our sleeves when it's our turn, and to get those vaccines into arms. That's how we're going to answer the call. So to the nurses here in Peterborough, Kawartha, thank you so much. You have inspired a generation of young leaders who see the impact of your work and will pursue the path that you've chosen, particularly in this difficult time. The update I'd like to provide you today is regarding vaccines. This is the second week of the increased dosage arriving here in Canada. More than 3 million doses arrived in Canada last week. 2 million more are arriving this week, and we'll continue to see doses, particularly from Pfizer, coming into our communities. Ontario will receive a little more than 3 million of these doses, about 1 million per week. And the numbers will continue into June, and we will confirm additional shipments from Moderna, so stay tuned for that. We also can confirm the next shipment of AstraZeneca, which will contain 655,000 doses, and we expect that to arrive in the coming weeks. So far, more than 18.3 million vaccines have been distributed to provinces and territories. 16 million have been administered. About 39% of Canadians have received their first dose. We expect that this summer, every Canadian will receive their first dose. And as we've said since the very beginning, come September, everyone who wants a vaccine will be fully vaccinated. For the time being, we know what we need to do. Get vaccinated when it's your turn. The best vaccine for you is the first one available for you. Avoid close contacts. As you heard Dr. Salvatierra said, 17 lives lost to COVID in our community. We are grieving with those families, and let's renew our efforts and our resolve to prevent more life lost, and let's prevent a fourth wave. Thank you.
Thank you very much, MP Monsef, and great to hear the good news about the increasing supply of vaccinations. Okay, let's move on to Mayor Therrien. If you have some remarks to share, please go ahead, Mayor Therrien.
Hi, Brittany. Thank you. Just briefly, because things have been covered by the board chair and Dr. Salvatierra and MP Monsef. You know, it's been a long 14 months, and I know that we are all tired and stressed, and it's okay to not be okay. And I'm very grateful to the provincial and federal governments for acknowledging and funding additional mental health supports. Had a conversation with MPP Smith last week about it, and MP Monsef knows, you know, that I will keep bugging about this. Because I think we're just seeing the tip of the iceberg in terms of the impacts that this crisis has had on people. But humanity has been through shitty times before, quite frankly, been through war, been through pandemics before, and we have survived and we will survive. And so I know it's been a long journey for all of us, and we're getting there. The sun's going to be out later. It was out earlier, and I think it'll be out later today and later this week. And so I think it's important to take time for yourselves, be kind, as Mayor Mitchell says. And we at the city are consistently working with public health and others to make sure that when we emerge from this, that we will be able to celebrate and return to some semblance of normalcy. So that's it from me, and I will be around for questions. Thank you.
Thank you very much, Mayor Therrien. Take care. Okay, I'd like to turn it over to our warden from Peterborough County, Warden Jones. If you've got some thoughts, go right ahead.
Okay, thank you very much, Brittany. And again, thank you for everything that you're doing to kind of be the liaison for these discussions. I can't say a whole lot more than what Miriam and Diane and Andy have said. You know, we've got to keep persevering here. We can't give up the ghost. We're trying our very best at Peterborough County, and I'm proud of all the county residents for digging in and doing their best. And you know, there's somebody I want to give a shout out to. Of course, the frontline workers and the nurses dealing with the patients, of course, and our EMS paramedics all deserve a huge pat on the back. But there's also a group who are the ones administering the needles at the Evinrude Center, for example. And my wife is one of them. And I'm very proud of the fact that she jumped out of the chair and put her name forward as soon as she could when they heard they needed some help. As a retired RN, she's doing her part to help. And, you know, if we all do our part in some little way, we'll get out of this even better. But holding a sign up and walking down the street, I don't know how that's helping any of us. So let's be part of the solution, not part of the problem. We're nearly there. And thank you, Rosanna, thank you again. I know you're probably sick of hearing thank you, but your leadership throughout this has been just huge. So take the time to smile. Diane, I'll give you a call if you want and tell you a couple of jokes just to get you smiling. It's the least I could do for you. So everybody, keep smiling, stay safe, and I like Andy Mitchell's line, be kind. Thank you.
Thank you so much, Warden Jones, and you always bring a smile to all of our faces. Okay, so now it's a chance to hear from our media colleagues, and I will work through the list of everyone I see here. There's a few new names that I see joining our meeting today, which is great, and if any of you are reporters, please just put your hand up in case I miss you. We're also grateful to have representatives from the Peterborough Police Service, so Chief Gilbert and Inspector Lyons are here with us. So when I call on you, if you could just be clear who your question is for. And let's start with Paul Rellinger from Kawartha Now. If you've got some questions, please go ahead, Paul.
I do, Brittany. Thanks so much. They're all for Dr. Salvatierra. Maybe I could just start with a couple clarifications. You mentioned, unfortunately, that a couple of the people that passed away had been vaccinated. Did I hear that right?
Yes, Paul. In fact, I know for certain that at least the last 3 deaths that we've had here in Peterborough were all people who had had at least 1 dose of a COVID-19 vaccine.
And I'm sorry, I know you said it, but maybe you could just reiterate what your message is in the wake of that. Basically, you know, if they don't kick in for a while after you're vaccinated, correct?
Correct, and we've had examples. I'm sorry, very sad examples of both people who were infected about a week after their vaccine, so there hadn't been enough time for the vaccine to work. But we've also seen, I know at least the person who died on Monday had about 4 weeks from time of immunization to time of infection, and that's an example of someone who just wasn't able to benefit from the protection of the vaccine. So I think it's a real sobering reminder to all of us that even with the first dose, We aren't fully protected, and we really can't let down our guard. We need to continue all of those important public health measures like physical distancing and not sharing the air with people who are outside of our household, and wearing our masks. Those are all important things we need to keep doing, even if we've been immunized.
Okay, thank you for that explanation. And again, not to belabor the point, but those deaths, were any of them outbreak related that you're aware of, or?
No, I don't believe they were. I think they were all people who either acquired their infection from a close contact or somewhere in the community.
Okay, great. And I wanted to get your reaction, if I could, if you have a reaction, to Minister Elliott was saying yesterday that it's likely, was the term she used, that there would be a mixing of doses for those who initially received AstraZeneca. This obviously out of a concern that there may not be enough AstraZeneca supply to do second doses. Although MP Monsef said today, I believe that there are some doses expected at some point. What are your thoughts on that? Because it's, there obviously are concerns amongst people who received AstraZeneca, but the research and the science into the mixing of doses is still ongoing at this point.
Right, so you're correct, Paul. In fact, and I wrote down, I was very pleased to hear from MP Monsef that the federal government has confirmed additional AstraZeneca vaccine, because I do know that, for example, we have our primary care providers here in Peterborough who immunized over 4,500 of their patients and are looking for second doses for their patients. The current recommendations from NACI is that you complete your series with the same vaccine. And so that is currently what we will recommend here in Peterborough, that you get whatever you had for your first dose should be the same vaccine you have for your second. But you are also correct in that there are trials currently underway where they are mixing the vaccines up to see if you may actually even get better protection by using different ways to boost the immune system. Those trials are not complete yet, but I expect that when they are, and when those results are available, we will certainly take them into consideration.
Okay, so it's a work in progress, basically.
It is.
I had just one more thing. There's been a growing call, I think mostly from municipal government officials, Patrick Brown being one of them, has been very vocal on this, but others, about outdoor activities and how they should be allowed. It's a good thing for people, even under this current lockdown situation. I just wanted to get your thoughts on that, because again, it's a call that's growing quite loud.
Well, definitely we know that being in the outdoors reduces the risk of transmission, but it does not eliminate the risk. I think, and that's the concern, is that, first of all, and I would encourage everyone to get outdoors and to exercise on your own, unless you're with members of your household. There are some activities that can be more safely done outdoors with others. For example, tennis comes to mind. I know we've heard of there are other sports that can be played where distance is not an issue. But the issue then becomes the socialization that often occurs either on the way to play the sport or perhaps after the activity is concluded. I mean, even around playgrounds, we know playgrounds are good for children and we encourage children to play, but the concern comes when other members will cluster and group around these playgrounds and will begin to socialize, not maintaining that physical distance, potentially not even wearing masks. So if we could somehow ensure that the socialization does not happen, we might be able to open up more of these outdoor areas for some of these lower risk activities. I personally think it comes down to supervision. and that it has to be done safely in a way that's supervised to ensure that those other more risky behaviors don't also take place.
Terrific. Thank you for your take on that, and thank you, Brittany.
Okay, great. Thank you, Paul. Okay, I'd like to invite Rob from Trent Radio if you've got some questions for our speakers. Go ahead, Rob.
Yeah, thanks, Brittany. And just one quick question for Dr. Salvatierra. I was really pleased to hear that you mentioned that there's possibilities of people receiving their second doses sooner than expected, and that sounds like it's already happening. That's really wonderful. Is there a plan? Because I know right now when you're booking your doses or your vaccination at the Everett Center, you're able to book your second dose at the same time. So lots of people have second dose appointments booked into August and September and soon enough into October, I'm sure. Would those people be notified if there was an opportunity to have a second dose sooner?
I believe so, and I believe, and that's one of the advantages of having everybody in the same database. It gives us the ability to identify people who can have their doses rescheduled potentially sooner. And I know that the province is working on those sort of behind the scenes workings to be able to allow that to happen a little more easily. So the short answer to your question is yes, we are able to identify people. We know exactly how long ago it's been since their first dose, and we should be able to reschedule them as easily as possible using the COVAX system.
Oh, that's wonderful. That's everything for me. Thank you.
Great. Thank you, Rob. Okay, how about our examiner colleagues? Joelle Kovac, do you have some questions today?
Yeah, I wonder if perhaps is there someone from police who's on the call at this moment?
Yes, I believe Chief Gilbert is here. We can start with him.
Okay, I wanted to ask about this religious gathering at Nichols Oval over the weekend. Just before I got on this call, I saw a photo shared on social media that made it look like there was something like it looked like a much larger crowd than I thought. I just wondered like how many people were there and if we know if that's been ongoing for a while on Saturdays, I'm understanding.
I'll defer that question, Joelle, to Inspector Lyons, who's been dealing with the issue on the weekend.
Excellent. Thank you so much.
Hi, thanks, Chief. Thanks, Brittany. And yes, Joelle, the gathering on the weekend, best guesstimate was approximately 30 to 40 people. There is information that may have been occurring in the past, but nothing concrete at this moment. There was a charge laid in relation to that on the organizer. And obviously now moving forward, we will be monitoring that situation on each Saturday and Sunday as well.
Oh, thank you so much. That photo I saw must have been from some other event or something. It looked like it was an enormous gathering. So I'm really glad to see that it wasn't as big as that. Thank you so very much. That's really helpful. Do we expect another protest this weekend as usual, or I saw something to indicate that people are going to Toronto to a larger gathering?
Yeah, so that's the national, if not the international day of protest that's planned for May the 15th. And it's my belief that there is a group that will be going to Toronto. But I'm also anticipating that there will be a gathering here in Peterborough as well for those that don't want to travel outside the area. We're just now preparing that every weekend is going to be the same. So and moving forward until such time as we have no further belief that it will happen.
Thank you so much for this. I'll pass it on to my other colleagues. Thanks.
Well,
great, thank you, Joelle. Reg Watson from the Examiner. Any other questions to follow up?
A question to Mayor Therrien. This religious gathering, anti-lockdown protest in Nichols Oval, has the city issued a permit for this? Is a gathering like that permitted by the city, or why is the city condoning it?
Yeah, so that's a good question. I wouldn't say that the city's condoning it. I will follow up about permits because I'm not sure, honestly, if one was issued. We're not issuing permits for any parks right now, so they wouldn't have had one. But I'm not sure if Brendan on the line has any further information about that, but I can also find out and circle back.
Thank you, Mayor Terry. And I would just reiterate that the city's not issuing any permits for park uses right now. So that event would not have a permit. Thank you.
So to follow up, since no permit is issued, what action does the city take from the city side that this is happening on city property?
Yeah, so we would try to prevent this from happening going forward. Brendan might have more information, but again, the city doesn't condone any of those gatherings. But Brendan has his hand up, so maybe he can add some more information.
Thank you, Mayor Terry. The city's working closely with Peterborough Police Service on the enforcement under the Reopening Ontario Act, and I would look to Chief Gilbert on this, but I believe the preferred method for enforcement in these types of situations is through the Reopening Ontario Act. Thank you.
Okay, thanks.
Okay, great. Thank you very much, everyone. All right, let's hear from Matt Latour from Freak and Oldies Radio. Please go ahead, Matt.
I've got two questions today, both for Dr. Salvatierra. You had mentioned that a couple of the more recent local deaths had been people that had their first dose of the vaccine. Is there any evidence to show that if you catch COVID after getting the vaccine, that it's any worse than beforehand, or is that something that's not really known?
Well, actually, that's a great question, Matt, because Public Health Ontario published their first report on the vaccine efficacy here in Ontario. I think they published it last week, and they looked at the first 3.5 million people who had been immunized here in Ontario. And what they found was that only a very small percentage, 0.06% of cases occurred in people who had been immunized. And the majority of those cases were in people within that first 2 weeks after their first dose. So 70% of the cases occurred before the vaccines had a chance to work. They also found that only about 9% of those COVID cases were in people who'd had enough time for the vaccines to work. So they were considered partially immunized. And that's what we've seen here in Peterborough as well. We've seen people become ill. And although the vaccines typically make the illness less severe, what we've seen is that certainly for those who have underlying chronic conditions or other illnesses, there's just not enough protection from the vaccine. So, so the good news from the province is that the vaccines are working for most people, but even at their best, they aren't going to be 100% effective.
When you say giving the vaccine enough time to work, how long does that take? 14 days, 21 days?
Right. Well, actually both, in that certainly they don't work in the first 14 days. So it takes up to 14 days to get some protection from the first dose. But when you look at the cases that have happened, we're seeing that really you need at least 3 weeks to start getting some protection from that first dose. So the longer, and by the time you get to 4 weeks after that first dose, typically people are between 60 to 80% protected. So I would say 3 to 4 weeks before you get that full benefit of 60 to 80% protection from that first dose. And then of course, you don't get the added benefit until you get that second dose, and that's when you get the full protection from that vaccine.
Perfect. And my last question is, you had mentioned that numbers both locally and provincially are still a little high to lift the reopening, or to reopen Ontario and here locally in Peterborough. Is there any kind of gold numbers in place as to when you think it would be safe?
That's a good question. We like to see the reproductive number down below 1. So that's a sign that the outbreak isn't growing. And we're close to that here in Peterborough. You'd also like to see the percent positivity lower than what it is. Here in Peterborough, it's about 2.5%, but provincially it's still much higher. It's 3 or 4 times that rate. And those are some of the numbers we're looking at, but we're also looking at capacity. We want to make sure that both the hospital has the capacity to accept people who require more intense care, and we need the capacity here at public health to follow up those cases and contact all of their contacts early enough that we can prevent ongoing transmission. So I'm sure it will be a conglomerate looking of different indicators that will be considered in making that decision about when it's safe to reopen.
That's it for me. Thank you.
Okay, great. Thanks so much, Matt. Okay, joining us from Havelock, we have Danelda Fraser. Any questions today, Danelda?
I have one question, but I don't think she'll answer it, so I'm going to just leave it.
Okay.
Okay, thanks.
Okay,
Thanks.
are you sure? Okay, that's fine. Then let's hear from Bill Hodgsons from Peterborough this week. Go ahead, Bill.
Just for Dr. Salvatierra, I don't know if you could share any more information on the 2 most recent deaths in terms of age or gender, or were they residents of long-term care or retirement homes, anything like that?
I can tell you that for the 2 individuals who passed away this weekend on Sunday and on Monday, that they were community members. They didn't live in long-term care. They lived in the community. I don't think we know the acquisition for one, but I can say that at least one of them acquired the infection from a close contact. We know that the ages, one was 64, the other was 79. They both had 1 dose of a COVID vaccine. So those are the sorts of things that I'm able to share with you.
No, I appreciate that. And my second question, and again, I'm probably like Danelle, I don't know if there's an answer for this out there. Are we seeing less people coming from the GTA being admitted to our ICU here?
I'm the wrong person to ask that question. That's a good question for the hospital, but I do know that they are taking care of both local people who are infected and needing care, as well as transfers from other parts of the province.
Thanks. I'll reach out to them. I appreciate it. Thank you very much.
Great. Thank you, Bill. Okay, so last but not least is Jessica Nisnik from Global News. Please go ahead if you've got some questions, Jessica.
Thanks, Brittany. Just for Dr. Salvatierra, and again, it's on the deaths. Mm-hmm. Do you happen to know, you mentioned the 2 ages, which was which day? You said Sunday, Monday, and 2 ages.
Yes, Sunday was the 79-year-old and Monday was the 64-year-old.
Okay, and any chance you'll let us know what vaccines they had?
That I don't know, but I'm afraid I don't know that information. So no, I guess the short answer to your question, Jessica, is no. I'm afraid I don't have that information, so I can't share it.
Okay, that's it for me. Thanks, Dr. Salvatierra.
Great, thank you. I think I saw Paul's hand up, but I think it's down now. So
Jessica asked a question, so thank you.
Oh, okay. Okay, great. So I trust that we've been able to go through all of our reporters and they've had a chance to ask their questions. So thank you very much, everyone. That brings us to an end. We will see you back here on Friday. And thank you very much for joining us. So see you at noon at the end of the week, and do stay safe out there. Thank you. Bye-bye.
Thank you.
Thank you.